Welcome to the Soulful Surgeon Podcast with Dr. Lisa Hunsicker, a sanctuary for healthcare workers. In this space, we honor your stories, your struggles, and your triumphs. Here, you are more than your role. You are seen, heard, and celebrated. Join me as we explore conversations that nourish the heart, elevate the mind, and remind us why we chose the path of healing. This is your time. This is your place. This is the Soulful Surgeon Podcast. Hello, everyone, and welcome to the Soulful Surgeon Podcast. I'm your host, Dr. Lisa Hunsicker. I'm a board-certified plastic surgeon, and this podcast and this platform is for you healthcare workers. So this is where we healthcare workers come to be seen and to be heard. We are valued members of this community, and we are going to come together and work together and share together and show one another all of our struggle points and our pain points, and we're going to laugh together. We're going to cry together, and we're even going to have some funny things that we're going to share throughout these many podcasts. So as I said, my name is Dr. Lisa Hunsicker. I'm a board-certified plastic surgeon. I've been practicing in healthcare for over 30 years, and I'm the CEO and owner of Revolve Plastic Surgery for over 25 years. In addition, I love to be in like adrenaline stuff. So I'm a race car driver. I'm a scuba dive master. So all these adrenaline things I love to do. Now, with all of these accolades, you would say to yourself, wow, this girl, she's got it going on and she must be on top of the world because now she's doing a podcast, right? Well, what you wouldn't know by looking at me is that the world was really on top of me. And so this really culminated back in 2012. And so I was going to work at that time. I was a single mom. I had a 7-year-old son, and I had a very, very busy practice, and I was in solo private practice, so it was all me. Now, on this particular day, the morning was already starting off hard. I have an ADHD son, and I am just hitting the snooze button for as long as I can. And so getting out of the house with the two of us and getting us to school and to work, it's like wrestling a marlin. Well, by the time that I arrived at work, I was already in full meltdown mode from being a mom. And then our day started. Now, this day was a very, very busy clinic day. It was never ending. I was booked all day, and actually I was double booked through several parts of the day. And so there really wasn't very much time to stop and do anything else other than take care of patients. So then it was time to go, and off I go into the 8x6 stuffy rooms and see patient after patient after patient. And there's really no time to eat, to go to the bathroom, no time to make calls to any of the patients. And so I just keep going, and I'm overbooked, and so I'm running late. Anybody ever run late? So now I'm going on and on and on, and I really don't have control of the schedule, and it's busy and busy. Well, in addition to all of this going on, I have a very dear patient. She's one of our breast cancer patients. And unfortunately, she's at home. She's actively dying, and I can't get to her because I have this packed clinic. So I have to keep going and keep going. Well, as I'm going, no lunch. Anybody miss lunch? No bathroom breaks. Keep going. I go in to see this patient. And of course, I'm late, and I apologized to her and said, I'm so sorry. I'm running late, and we have this awful thing. This patient is dying, and we've just been dealing with all of that. I'm so sorry. And this patient actually interrupted me in the middle of my apology to her to say, I don't care. You need to put Botox in this wrinkle right now. And I just snapped. And it's interesting because I didn't lash out at the patient. I lashed out at me. And how am I going to continue on? I've got all these responsibilities. How am I going to get out of this? It's impossible. And this snowballs, and I'm suicidal. And at this point, I think it's a really good idea to just go away. But then when I start thinking about it, I start worrying. I've got a little boy at home, and what's going to happen to him? So I just go back into my office and I crawl up into my chair and I am panicked. I don't know what to do. I can't breathe. I'm nauseated. What's next? What are you going to do, Dr. Hunsicker? Well, I realize, this is a dire situation and I need to go to the emergency room. So I go to an emergency room and I meet with the on-call psychiatrist. And both of us, after talking, realize that this is pretty dire and I'm pretty serious about this. And so I am in imminent danger and I need to be admitted. Well, at that point, Dr. Hunsicker kicks back in because I now realize and remember, oh no, tomorrow I've got a breast cancer surgery. And this is a big cancer surgery that we've planned for quite some time. It's an all-day event. And how am I going to cancel on this patient? And I think to myself, how can you penalize this patient? It's not her fault. You don't have the ability to manage all your stuff. She doesn't deserve that. You need to show up for her. So after talking to the psychiatrist, the both of us agreed that it was a good idea that I go home. And I go back to work the next day, and it's a good idea for me to go do her surgery. So I'm not human doing, I'm a human being, but that's not how we're treating me. And it's not physician heal thyself, it's physician sacrifice herself. So how am I going to get myself out of this? How do I make it through? Well, it's at this point that I realize, you know what? It's up to me. And the only person who's going to get you out of this, Lisa Hunsicker, is you. And so what I ended up doing is took a Sharpie marker. Us plastic surgeons, we love Sharpies. So I took the Sharpie marker and I wrote my son's name on both of my hands in Sharpie so it didn't wash off. And this way I had a way to constantly remind myself of my priority. So when I went to the OR the next day, it was very easy to pass off as a child game of playing with my son. And oh yeah, we're writing each other's names on our hands. But also in the OR, when I put my gloves on, I can see that name underneath my gloves. And I realize this is my true priority and this is what I've got to do. I've got to get to a better place. So in this deep, dark time, what I found to be most helpful for me is what I like to call my OR method. And what that is that I diagnosed myself, I cut right down to the core of my own being, then I took myself to recovery. Now I did that was with my own 7 Remedies of Being. And so these are the different facets of us as human beings. And that's our physical being, our mental being, our spiritual being, and our sensory being. And those really are about who we are as beings. But in addition, how do we relate to other people? So we have our relational being, our community being, and then our intentional being. What is our purpose? Why are we here? Why do we get up in the morning? And where do we go and what do we do? And is that in our own alignment with how we feel purposeful? Or does it conflict with it? And for me, this was a big sign that I needed to align these up. Now, this podcast is for healthcare workers, and we can heal ourselves, and we can transform who we are and get out of this human doing and get off the grind and really get to be a human being. It's going to take some time. It's going to be a lot of laughing and a lot of crying, like I said, and we're going to go through this together. I'm going to have lots of guests on our podcast, and some will be me as well, just alone talking to you about thoughts. And it might be, I've had a really crummy day, and this is what happened to me. And I'm going to ask you all to please tell me about some of your hard spots. And maybe it's just 1-minute video that you can send to me, being as concise and also being HIPAA sensitive as well. But tell me what happened so that we can share this with all of us, because we are a big community. And this community is physicians It's nurses, it's nurse practitioners and PAs, it's respiratory therapists, it's all of the allied health and everyone who supports us, anyone who is delivering patient care in some manner. We all need to come together and be a single community and really lift each other up. We can transform this community, and we're going to do it one day at a time on this podcast. So again, thank you. My name is Dr. Lisa Hunsicker, and I am your Soulful Surgeon. Thank you for joining me on the Soulful Surgeon Podcast. I hope today's conversation offered you reflection, encouragement, and a reminder that you are not alone on this journey. If this episode spoke to your heart, please share it with someone who might need it as well. And don't forget to subscribe so you never miss a moment of connecting with healthcare workers all over. You can find us on the web at soulfulsurgeon.com. You can find us on Instagram at Soulful Surgeon. And you can find us on LinkedIn at Lisa Hunsicker, MD. Until next time, take care of yourself the way you care for others. And remember, your story matters here.